Bismillahirrahmanirrahim. Welcome back friends. Welcome back to another video lecture by Kami Microbiologist. I hope all of you are well and fine. Today in this video we are going to explain another lecture, that is the bicarbonate blood test. So bicarbonate blood test is actually the electrolyte test. If you guys remember, we already talked about different electrolyte tests, like we talked about sodium, potassium, calcium, magnesium. So we already talked many of the electrolyte test. If you want to watch all these video lecture related to electrolyte, you can go back to my channel and watch these video lecture. So today in this video we are also going to talk about bicarbonate blood test, that is also related to electrolyte test. My name is Muhammad Kamil Khan and you guys watching my channel Kami Microbiologist. Let's start this topic. In this video lecture we are going to explain that what is bicarbonate, function of bicarbonates, diagnostic purpose of bicarbonates, test procedure, normal range, main causes of high and low bicarbonate. First of all, let's see that what is bicarbonate. The bicarbonate is actually represented by HCO3 and it is also called what? Hydrogen carbonate as well. The bicarbonate is actually the electrolyte that can be released when the food are break down. Okay, for we better know that when the food are break down, so it can release the energy. So during that time the bicarbonate will be also released. Bicarbonate is actually the form of carbon dioxide, or we can also call that the part of ABGs, means arterial blood gases. Bicarbonate is actually found in water and soil. Moreover, the bicarbonate is maintained by kidney and lungs. Bicarbonate, the main function of the bicarbonate, if we talked about the bicarbonate main function, so it can measure the carbon dioxide in blood, it can maintain the acid base balance, it can also play important role in digestion and respiration. Moreover, it is used in the baking soda in industry. Now let's see the bicarbonate diagrammatically. So as you can see, this white powder is actually representing the bicarbonate. If we see the chemical formula, so this is the carbonic acid. Okay, so when one hydrogen is removed, we call that bicarbonate anion. On to the bicarbonate there is a negative charge. Okay, so that's why it is called bicarbonate anion. So another hydrogen, whenever another hydrogen molecule is removed, so we call that carbonate anion. Okay, now let's see that what are the diagnostic purpose of the bicarbonate. So it can monitor the acid base balance, it can diagnose kidney respiratory disease, it can assess the treatment efficacy. Moreover, it can also evaluate the electrolyte imbalance. Let's see the normal range of the bicarbonate. So whenever you want to collect the blood from the artery, so the normal range of the bicarbonate in the artery should be 22 to 29 milliequivalent per liter, or we can say millimole per liter. When you isolate the blood from the vein, so the normal range of the bicarbonate is 24 to 30 milliequivalent per liter or millimole per liter. Now let's see the test procedure. So it's very simple. First of all, you have to take the blood from the artery or vein, and then you will collect it into the heparinized syringe, or you can collect it into the green top, which we call that sodium heparin or lithium heparin tube. After that, you will run it on an advanced machine. Okay, so this is the simple procedure. Now let's explain the main causes through which the bicarbonate level get high into the blood. So the first is Cushing and Cohn's disease. Cushing's is actually the hormonal disease in which the hormone like cortisol hormone get increased, and Cohn's is actually the intestinal disease. This is actually the which we can say the digestive tract inflammation, especially the intestinal inflammation, we can say like that. Hypoventilation, in which the ventilation is become low, means the air flow are become low. So due to this way, what will happen inside the body, the carbon dioxide level get high, that will eventually increase the bicarbonate level. Next we have pulmonary edema, in which the fluid will increase into the lungs, especially into the alveoli. Next we have anorexia nervosa, in which the patient will feel fears when they are taking the food, so their weight will be gained, although their weight is not increased by taking diet, okay, because dietary food may not increase the weight. But if the patient taking the food and they have fear from the food and thinking that maybe it will increase their weight, so this is called as anorexia nervosa. We can say it is actually the psychotic disease. Next we have metabolic alkalosis, in which the alkyl amount or in which the alkyl get increased into the blood. Next we have chronic obstructive pulmonary disease, in which there is obstruction into the pulmonary area, like in trachea, like in the alveoli, like in the lungs, etc. Okay. Next we have loss of acid due to vomiting. It may also increase the carbonate level. Next we have diuretic medicines, like we have hydrogen ions containing medicines. So these are the main causes through which the bicarbonate level get increased. Next we have the low bicarbonate causes. So let's explain that what are the main causes through which bicarbonate level get low. First is uses of aspirin. So when we use a lot of aspirin, so it will decrease the bicarbonate level. Next we have Addison disease. So Addison disease is actually the hormonal disease in which aldosterone in which the adrenal gland are not producing enough hormone. Okay. Next we have ketoacidosis. It is actually the disease in which type 1, especially in type 1 diabetes mellitus, what will happen, acid will release. So this is called as ketoacidosis. So instead of insulin, so acid will release. Okay. Next we have diabetes and diarrhea, heart and kidney failures, and starvation and malnutrition, of nutrients intake in the body. Okay, or severe nutritional deficiency, we can say starvation or malnutrition. Okay, so due to this way the carbonate level will get decrease in the body. So this is all about the bicarbonate test. Thank you so much for watching this video. If you like this video, make sure to hit the like button, share this video, and also subscribe the channel to get more interesting videos like that. Thank you so much for watching this video.